Let's have this discussion. As a healthcare manager, you'll work with the different teams. You'll work with healthcare providers or healthcare workers, the specialists, the general practitioners, who can be nurses, who can be general doctors, who can be obstetricians, surgeons, and the rest. But you also work with the non-medical staff, yet they are actually essential in the provision of quality healthcare. Your interest as a healthcare manager is to ensure that basically the patients are getting the best type of care, best quality of care possible, and also if it is a private for profit organization or healthcare organization, then the shareholders would expect to make some profits. Okay, so today we want to look at these these non-medical professionals who are very important in the provision of healthcare services in the hospital, and specifically in relation to information management, health information management systems, which is our area of concentration. So we are going to look at the information technology staff, the IT people, and how you will be relating with them. What do you need to know about their roles, and what management structures need to be in place for you to be able to optimally work in an organization. Okay, so that is what we are going to discuss. First of all, just as a reminder that a health management information system has different components. Just like what we have been emphasizing, that a system has different components or different parts that work together for a particular purpose. So for health management information system, we have the human and the non-human resources working together to make sure that we have this very good data, health data, that we can use to improve health outcomes of the population, but also the health outcome of the individual patients that come to our hospitals. So the human component, of course, these are the professionals that you need to be able to collect, analyze, and disseminate this information that you have collected. Okay, so often you may think about the data clerks, the people who analyze this data, who collect it and enter it into the computer systems. That is basically those are part of a larger team. For you to produce good quality data, that data often emanates from the physician or the nurse that is directly interacting with the patients. Okay, so for example, the nurse will take the vital signs, and the vital signs will be useful to the physician, the attending physician, to make a diagnosis and be able to prescribe the right treatment plan. So that the data that is collected from the patients has to be collected accurately, because it will help the physician to make the right plan. Okay, so the physician also will collect further data on examination. For example, they will note the signs and symptoms of the patient and document. All this information will still enter into the system, plus the laboratory requests that they will make. They will make laboratory requests, still that is data. And then the laboratory requests, the results when the results are out, that is still data, and that data comes back to the physician. And then the physician will now come up with the definitive diagnosis and the treatment plan. So this data is collected over and over and over again for every patient that comes, and this data is what is fed into the computer systems. Okay, that means that the duty or the roles associated with the data clerks, it's not that they are the primary people who collect this data from the patient. The direct healthcare providers are the ones that are interacting with these patients and generating this data. Okay, so when we talk about the human resources for health management information systems, we are not only looking at this person who sits in front of the computer and enter this data, analyze it, and perhaps forward it ahead, but we also need to recognize that we also need to look at the primary health workers who are interacting directly with the patients, because they are also involved in the collection of this data. So that means that all these personnel need to be aware of the characteristics of ideal data or quality data. This can happen in a health system that is well equipped with the resources to be able to collect this data. Primarily, you need to have the policies in place. Okay, the policies need to be in place. The National Health Management Information System policy for that country need to be in place. This will outline the roles and responsibilities, the procedures that will be that have to be undertaken in collection of this data. Okay, and then of course the equipment, which in this case can be you need to have the forms, the appropriate forms. These forms can be electronic or they can be paper forms. Okay, and then the concepts to do with what data needs to be collected and what standards are being used. This is very important. If you don't have the same units being used, then you have a problem of data consistency that we talked about, where we say that if we don't collect data consistently, then you will have challenges. We'll refer to that, to the fact that the data has to be of the same format, otherwise you bring consistency issues. So the IT staff become very, very important if you have electronic health information management systems. Often in our countries, we have a mixture of the two. At the lower primary healthcare facilities, the data is collected using papers, physical papers or physical forms. And then as we move to higher levels, that's when you have these computers which have these programs for data, for health data installed on them. Okay, so that means that where you have these computers, you need to have people who can manage these computers. So this is where the IT professionals become very key, because it is not very feasible to have primary caregivers, the doctors, the nurses, and the others, to be involved in entering this data into the computers, because that is not their area of specialty. So specialized IT staff are needed to make sure that these IT systems run smoothly in handling this health data. So of course, these IT specialists or IT professionals will perform different roles. Okay, you can have those that are called the system administrators. We have network security management. We have user support and training. You have app development or application development and integration, data analysis and reporting. So we are going to look at each of these categories to see what do they really do. So the systems analyst, here you can see that there is a person who's looking at how things are done. The operations, how are the operations flowing? The information is coming from where and it is going to where? And is it moving efficiently or there are delays? So the systems analyst helps to identify areas of delays, what we call areas of pain. That means that where things are not moving as they are supposed to move, then he gets the solution to address those problems. That is the systems analyst. Okay, so they identify these problems and then come up with a solution that can address that challenge. But again, he will not be the one to develop the IT solution. So that is where the computer programmers come in. For IT programs or software, they are developed by what we call computer programmers. They are the ones that develop the programs that you use. Okay, the computer programs that you use. It is a computer program for taking history, for taking vital signs, for healthcare, financial management, or what you can call a hospital management system. These are developed by what we call healthcare IT programmers, or basically computer programmers. So the systems analyst comes up with a saying this needs to be done such that this problem is solved, and then the computer programmer now develops that tool to be that computer tool to be able to solve the problem that the systems analyst solve. And then we have the network administrators. What you need to know is that within a hospital system, or basically at, let us say, at a national level, you have different computers connected, forming what you call a network. Okay, these connections can be through wireless connections, or they can be through cable. Okay, cable connections. So not only the computers, there also could be other hospital devices that are connected to this network. So the network administrators are responsible for making sure that these connections are working efficiently. Okay, so if there are disconnections, they troubleshoot to identify where the problem is and then rectify it. Okay, so they do maintenance of these networks and improve security measures such that these networks are not intruded by hackers or other criminals. Okay, and then we have database administrators. So if healthcare information can be stored locally on local servers or can be stored at another place, third-party servers. Okay, so if you have these servers in place, that means that you need to have a person who look after these servers or this database, such that there are no people who are gaining access to it. Okay, such that this information is actually updated, and they are also creating backups in case of any problems. One of the things that will happen is that when there is a security breach in these IT systems, one of the things is to disconnect the data online such that it is offline. Okay, so that disconnection all cuts off the person who is trying to access the data. So the role of the database administrator is to make sure that this database is maintained, even in its encrypted form. Okay, such that there are no failures. If someone wants to access the data, they can do that, provided they have the appropriate authorizations. Okay, so those are database administrators. And then these ones, most likely you're familiar with them, those that are involved in developing websites or even web applications, and they support personnel. So for example, the hospital introduces its own application, okay, where the clients can ask questions and they can be answered, where there are reminders for them to take their drugs, or reminders for them to take their tests, if it is checking it as, say, blood glucose levels and things like that. So a hospital can have an application on its own application to do all these different things. Now, the people who develop these ones can be web designers who have the capability to develop web apps. But basically, we still also go back to what we talked about earlier on, the computer programmers, that they actually can also develop these apps. Okay, so it is basically likely that you can have an IT person who has all these skills, okay, because that is their area of specialization or training. So that means that they can have these skills in web design, designing or developing web apps, programming and other things. Okay, that's an important thing to note. So you realize that if you have a strong IT component in the hospital, or not only in the hospital, in the at a national level, where you have the national health information systems that are electronic in nature, that means that you will have a way in which you have to deploy IT staff with different levels of skills to manage all these computer systems that manage this health data at different levels. So that means that you need to be familiar with their titles. For example, here we put a structure for a hospital setting. Okay, so within a hospital setting, you can have more than 5 IT people. Okay, you can have a chief information officer, who is basically the top person overseeing the ICT strategy and goals. And then you have a person, chief technology officer, who oversees the technology infrastructure and innovation, depending on whether you actually need this person, and other things like that. And then we come to the core skills that they need to have. Now, why did I bring this up? I bring this up with the thinking that you will be involved in either recruiting these IT persons. As a healthcare manager, you'll be involved in recruitment. Okay? So that means that you need to know the skills and competences that these people should have in order for them to do their role. Secondly, you may also be involved in selection of vendors. Okay? That means you also need to know how to assess their performance or competencies as vendors. So for all professions, the people should be technical in their area of expertise. Okay, so they should demonstrate that they really understand the areas of ICT. So knowledge and technical skills are very, very key. And then project skills, communication and collaboration, these ones are cross-cutting. Every professional should have proper communication and collaboration skills. And then they should be aware of the legal requirements in healthcare ICT. Okay? It's only that in our country, we are still behind in terms of incorporating technology in our healthcare systems or hospitals even. But in places where ICT is well developed, it means that for everything that you do, you really need to be cautious against breaking any of the regulations that are in place. So definitely you will have a lot of people doing the work in the IT department. What is very key is that they should work collaboratively. So that means that team management is very key. And we are going to look at the dynamics of team management here, because I believe you have covered that already in the foundations of healthcare management. So team management is very key in managing these teams, because you work with them on different projects. So in a hospital setting, you will make a decision on whether the ICT solutions have to be in one place where everything is managed in one place, or every department manages their own health information systems. Okay, so we have two types. When you manage the data from all departments in one place, in one central point, that is centralization. If every department manages their own data systems, then that is decentralization. They come with advantages and disadvantages, of course, which we shall look at shortly. But basically, if we are going to look at it in detail, we are saying that the decentralized model, where you have the control being at one point. If we are going to look at the national health information systems, then we are going to say that the data is sent to the national data center. Okay, so the data that is collected from the lower levels is sent to, and in the next level, the other, until it reaches the top for coordination, analysis, and dissemination. Okay, that is decentralization. Now, for centralization, I think I mixed up. For decentralization, the different areas, let us say different states, in our case, they do their own, they have their own data systems that they collect, analyze this data on their own. Okay, and they can forward that to the national level. Okay, when it comes to the centralized system, which I had earlier on explained, is that the work is forwarded to the top, and then much of the work is done at the top. That is at the national level. Okay, that is what happens. Okay, so I will not go into that. The centralized model, of course, it is quick. You know that the data comes to the top, and therefore that means that you will not waste a lot of resources on the lower levels, because they don't have a lot of work basically that they are doing, because the work is sent to the national level. But for the challenge with that is that the data is sent forward, and then the analysis is made at the top. That means that the insights, the local insights about these data sets cannot be obtained. So that's an element of local ownership, that since the data is processed at the top levels, the lower levels do not gain sufficient insights and local ownership about the data that we generate. So that's the challenge that we have there. So decentralized could be perhaps a better option, where you see, if you analyze your own data at your department level, that means that you are really very concerned about the data quality. You are concerned about what the data is saying. You're very concerned, so you'll be able to respond to the needs that you have in terms of the data, okay, than when it is actually centralized. But of course, if people do their own things, that means that there are possibility that they may not really enter this data appropriately. So you will have issues of inconsistencies in data collection and analysis. Eventually you have inaccuracies or inefficiencies in the data. So how do you decide, do you need to have a centralized or a decentralized system? It depends on the nature of the health facility that you're actually operating, the amount of resources that you have, the competencies of the ICT people, and the ability of the ICT people even to work closely as a team is also very important. But you also need to really, the resources need to be available if you're going to choose, let us say, decentralized. Okay, so you have to look into these factors to make the right decision. Okay, so if it is about let us say the National Health Management Information Systems, still the same factors that you have in making a decision on a hospital will still apply at the national level. Still will look at whether you have the resources in terms of whether money, in terms of the human resource, or also in terms of the equipment. So you need to look at these issues and make a decision. Okay. So in a hospital, you may have to decide whether you need to hire IT people and do the work, or you need to outsource the work. Okay, when you hire the people, the ICT staff, to do the work within the hospital, then that means that is in-house ICT. You have a team to do that. But if you say that I will not be able to have a team on ground to do the work, then you may need to hire an organization that will oversee the ICT operations in your hospital. That means you are not managing them at individual level, but you're dealing with them at an organizational level. So if there are issues, you address them to the organization, because you enter into a contract with the organization, and then the organization sends their team to do the operations, to manage the systems. So that is outsourced ICT. Okay? So still you have to make a decision on whether you need your own staff to do the work, or you need staff that have been deployed by another company. So you think about issues to do with how much money do you have to hire these people, and are these people actually available in the market? You may need to hire them, but they are very few. How quick do you want the issue to be solved? Okay, how quick do you want the ICT systems in place? That also can determine how much money do you have, and of course the top management of the hospital have a big say in whether you will be given the resources to outsource or even to hire people on a full-time basis to do that. As a healthcare manager, the ICT or the IT in the health facility plays an important role in patient care, in improving efficiency, and also eventually in terms of increase the returns on investments. So that means that you need to have the IT team working efficiently and effectively for you to be able to have those goals attained. So some of the things that you need to assess to see if the teams are actually working, and of course issues to do with the infrastructure. Is the ICT infrastructure within the hospital working properly? If it is internet, if it is intranet, if it is all these ICT enabled devices, are they working? Okay, is the hospital having functional governance structure for the ICT department or not? Because if you don't have governance leadership, then the ICT department will not be working effectively. Okay, and then if there are problems within the ICT area, are these problems being addressed promptly and effectively, or we have problems that go unaddressed? A computer fails to connect to the internet, and then that problem is not solved. A given device cannot connect to the network, and then it is not solved. So those issues bring in issues to do with whether the ICT department is actually performing or not. Okay, you might need to hire consultants, and with this you need to be very careful in choosing which consultant you may want to improve the ICT systems within a health facility. Of course, you should be familiar with how you release a bid, okay, inviting for consultants to come, and then you select one. Okay, so do you have the expertise to make sure that you get the best out of this consultant, who is going to assess the ICT infrastructure processes and the needs that you might have in the health facility. So working with consultants is very important. You need to know that the team is actually doing excellently well if things are working, moving smoothly, there is efficiency, effectiveness, there is no intrusion, there are no data leakages, the systems are reliable, the internet is always on, the internet is always on, and if you need expansion, you can easily implement that expansion. That is an issue to do with the scalability, flexibility, moving from one technology to the other. That's very important. And then innovation. So that means that for this team of IT that you have in the hospital, you need to be able to assess their effectiveness, their performance. Okay, you need to have an idea on what are the things happening in their area, such that you can work effectively. Okay, so that marks the end of this presentation, where we have focused on aspects to do with how you work closely or collaboratively with the IT personnel, and we emphasize that you really need to know what they do and how to make sure that the IT infrastructure within the health facility is well maintained by either the in-house or the outsourced IT people, to make sure that the operations of the health facility are actually running optimally. Okay, so if you have any questions, please let